By contrast, in Laos, fresh water is associated with a completely different set of images. One of the poorest countries in Asia, Laos is the place that the fast Asian development of the last decade has left behind, with 66% of the population living under $2 per day. Roughly, half of the Lao population has no access to safe water. Health problems related to unsafe water, such as typhoid, diarrhea, and parasites, are a major factor behind the region's high child mortality rates. 98 out of 1,000 children under the age of 5 die, diarrhea being the primary cause of child death in Laos. Headquartered in California, the Lao Rehabilitation Foundation, a non-profit, non-religious, and non-governmental organization, provides medical services to the Lao people in remote areas of northern Laos with a greater focus on disparate populations, especially children and the poor. Over the last decade of medical missions, treating nearly 20,000 patients, the Foundation observed firsthand that a scarcity of fresh water is the root cause of many health problems. This was the basis for prioritizing the Foundation's efforts toward improving access to clean water in Laos. In order to have a significant impact on public health in these remote villages of Laos, the Foundation partners with engineers internationally and locally to design and implement efforts to build gravity-fed pipelines from a freshwater source at a higher level or drill a well. These efforts require materials and labor, which can be as little as US $15,000 or as much as US $50,000, depending on the complexity of the situation and unique challenges specific to each community. Ensuring freshwater access in the schools is always a priority. The villagers contribute on average 15% of the cost in labor and materials. To sustain clean water access, the Foundation engages and empowers the villagers in the upkeep of their freshwater facilities. In many cases, each family contributes to a fund to maintain the water system. Education across villages to help increase and maintain awareness is another critical component to sustain these efforts. Participation in the planning, building, and troubleshooting of a water project also leaves the villagers with valuable skills they can use in other areas. The impact of the water initiatives and medical missions of the Foundation is an immediate reduction in waterborne illness like typhoid and diarrhea. Profound social impact occurs when women and children no longer have to spend hours fetching water and can now focus on productive activities like education. The Foundation focuses on schools and children as agents of change in their communities. Dozens of communities have already been identified where either a water pipeline or a well would be feasible to have a significant impact on the health of the local population. For as little as US $15,000, you too can help break the poverty cycle for 1,000 people and, most importantly, save lives. Thank you for your support.